Good afternoon. Chairperson Downey and members of the Assembly Human Services Committee, thank you for accepting my testimony today. My name is Peggy Jacobson, and I have worked with children and adults for over 23 years, 14 of which have been spent at New Jersey Mentor, where I currently serve as a regional director. I am a member of the Alliance for the Betterment of Citizens with Disabilities, also known as ABCD. New Jersey Mentor has been a longtime partner with the state of New Jersey. Founded in 1990, New Jersey Mentor supports adults and children with intellectual developmental disabilities, including people with mental health diagnosis. We employ over 600 staff and contractors in residential neighborhoods in 17 counties throughout New Jersey. New Jersey Mentor is also a proud member of the board of Alliance for the Betterment of Citizens with Disabilities. Our continuum of care includes our community care residents, or host homes, where people live in private homes with dedicated caregivers who we call mentors, as well as structured day programs and hourly support services. We also offer living residence group homes with 24/7 support staff and expert clinical services. These homes have people living together with similar needs or levels of support, which includes several of our homes supporting people who are duly diagnosed with mental health disorder. When we use the term dual diagnosis, we're referring to people who have coexistence of symptoms of both intellectual and developmental disabilities, mental health problems. Persons with dual diagnosis can be found at all ages and levels of adaptive functioning. This coexistence of diagnosis can have a serious impact on persons' daily functioning by interfering with their vocational activities, jeopardizing residential placements, or by disrupting relationships with their peers and family. The presence of behavioral and emotional problems has been the potential to reduce the quality of life of persons with intellectual and developmental disabilities. New Jersey Mentor provides specialized services to address this unique set of challenges, and yes, it is definitely a unique set of challenges. People living in our group homes who have been duly diagnosed require supports tailored to their needs. We employ behaviorists who identify strategies that will assist the people we serve and the staff supporting them to improve quality of life and maintain safety. For example, behavioral support plans are developed specific to the person and created based on data collected through observation, documentation, and feedback from the person and the people they interact with. Behaviorists not only create the plan, but they ensure everyone interacting with the person has proper training to implement it, whether in the residence or at the day program or elsewhere in the community. Behavior plans are continually being reviewed and adjusted as data is collected or as needs of the person being served changes. Many of the people we serve, especially those with dual diagnosis, take psychotropic medication to assist with management of their symptoms. New Jersey Mentor trains staff to administer medication and also employs nurses to provide medication management and overview. Our nurses communicate both internally with direct care staff and behaviorists, but also consult with natural supports, including primary care physicians, specialists, such as psychiatrists. One of the roadblocks that we do find serving this population in the community-based settings is a lack of service providers willing to be able to address the needs of those with intellectual and developmental disabilities. Oftentimes, there are few providers willing to take on those we serve due to the complex nature of their presentation, given the low reimbursement rate from Medicaid. Over the past several years, provider agencies have been experiencing a transition from a contract to a fee-for-service environment for those people served by the Division of Developmental Disabilities. As individuals with dual diagnosis have transitioned to fee-for-service model, we are seeing that the new rates are lower than under the previous system and are often inadequate for their needs. To determine a person's tier or their funding level, an assessment is completed, which is called an NJ Comprehensive Assessment Tool. And we also refer to that as NJ-CAT. People will refer to that way as also. This assessment seems to be geared more towards identifying medical needs or needs relating to activities of daily living, with less emphasis on behavioral and mental health needs. As a result, individuals with diagnosis are being faced with difficult choices in terms of supports they receive. New Jersey Mentor is a provider, both individually and as part of ABC, is advocating for the division to look at the tier system with a specific eye for this population. They're being left behind by the transition to fee-for-service. We are concerned that the quality of life will negatively impact, and it could have serious consequences for them and those in the community. We know these people can be successful and productive members in the community, but only when their dual diagnosis conditions are properly identified and supported. Another challenge we're facing as all providers is the direct support professional workforce crisis. And you've already heard that's been mentioned quite some time already. Nationally and in New Jersey, providers face a critical workforce shortage with high turnover rate and vacancy rates. This workforce crisis has a direct impact on the individuals that we support. Direct support professionals work with the same people, sometimes one-on-one, and sometimes for many years, developing a deep personal relationship. High turnover can be personally disruptive to the people we serve who have dual diagnosis. To be clear, we want to pay our employees more, but we are price takers. We're not price setters, and do not have the ability to cost shift. Virtually all of the funding that we receive comes from Medicaid. So Medicaid rates that we receive determine wages that we can pay. We are grateful for the funding that the legislature allocated for FY18 and FY19 budgets that increase rates directed at DSP wages. Despite these increases, the scheduled increases in the minimum wage will likely deepen the workforce crisis without further or proportional rate increases. Even after the legislatively approved wage increases, the rates for all providers currently assumes $11 an average, which is the wage we will reach in 2020. Once again, we want to pay our workers more, and we do not oppose the future increase in minimum wage. The work we provide, however, is not minimum wage work. We're a profession that is supported some of our state's most vulnerable citizens. That is why we support ABC's request for the rate increase in FY 2020 budget, and that it is proportionate to the increase in minimum wage of 23%. Thank you for granting me this opportunity to provide testimony.
Thank you so much.
You're welcome.
I do have a question, because I wasn't aware of this, that you actually do have